My name's Lindsay Paris. I'm from Glasgow, west coast of Scotland. I work in the insurance industry and have done for 20 years now. 37 years old, and I've recently been, within the last year, happened to be diagnosed with malignant melanoma. I knew about melanoma because one of my friends has recently been diagnosed, although it was just on the surface. It hadn't grown into the epidermis layer of the skin. But also my friend's mother has got skin cancer and malignant melanoma, and her case is a bit more severe, currently stage 3, and it's spread several times. She's had a lot more treatment than I have, but still never crossed my mind at any point that I may have the condition also. I noticed a mole was changing. Still didn't particularly think I was at risk of melanoma. Knew that it was caused by, well, I'm assuming it's caused by too much time in the sun, use of sunbeds, etc. And I happen to be in that category massively. Enjoy looking good when you have a suntan, going on holidays with the girls, going on family holidays, probably 4 times a year, always to sunny places. And I would spend all day, including those times perhaps 12 till or 11 till 3 that you perhaps should be staying more in the shade. I was out there tanning the skin. Perhaps I was being ignorant to the fact, but at 37 years old, it's not going to happen to me. Too young for something like that. But went to see eventually took myself to the GP after noticing this mole on my lower back had been changing probably for over a year. I noticed and thought, oh, it's fine. Don't need to see about it. I had a young child at the time. She was just coming on 1. Life was busy. Still decided, don't need to go and see about this. Everything will be okay, I'm sure. Until one day, I don't know, it came into my mind, do you know what, I'm going to just go and ask the GP if he thinks this looks okay, because I'm just getting rather a bit worried now. Went to the GP. He didn't say too much, only that he would refer me on to the dermatologist at the local hospital. Appointment came through pretty quickly. About 3 to 4 weeks' time, I was speaking with the dermatologist, and immediately he took one look at it. I was sent to get pictures taken, measurements taken, and taken straight away to have the mole removed. At no time did I think that even then that I had malignant melanoma or any type of skin cancer. I just thought, this is routine. Moles, quite big. I had noticed a little change in colour, colouring, like a small reddish type. It wasn't even black that you should be looking out for. It was reddish in colour, small blister within the mole itself, and that it started to, the diameter was just starting to look as if it was spreading a little. Therefore, I still, again, thought, no, it's fine. They're taking it out as a precaution, only a precaution. Then went on holiday again, beautiful suntan, to come back to see the dermatologist. For him, about 3 weeks later it would have been, for him to deliver the news that I did actually have malignant melanoma. At the time, I was listening to this news, but was not absorbing what it actually meant. A huge smile on my face. Thank you very much. I had my daughter's now 2, had my 2-year-old by my side. I thought, oh, better make sure she's not touching things she shouldn't be. Thanks very much for the news. I'll see you later. And that was it. The recognised, I think, that, you know, you've just been told you've got malignant melanoma, which is perhaps one of the less, if there is a best kind of skin cancer, which I doubt, it's probably the least or the worst case scenario that you want to be told of. I love to visit maybe farther away places where the sun is stronger. I was a bit upset that I thought I could no longer do that. I could no longer go these holidays and enjoy time in warmer climates. Let's face it, I live in Scotland where it's particularly rains a lot. So I thought it was a bit of a death sentence at first as well, before I read into and obtained more information about how bad if there was any spreading, what size the actual melanoma was, the depth of it. I never asked any of that information when I was diagnosed. I just said, thanks very much, see you later. So I went through the weekend thinking about how life was going to be in the future. 2-year-old daughter running about, was I going to be there in the future? And then I decided to phone the nurses that were present at the time. So I got all the information, which was, in my situation, was very good. The growth was fairly, it was slow. The melanoma was developing slow. The depth was under 2 millimetres. It had, however, grew into the epidermis and the layer below. However, my next treatment, I wasn't advised I was going to need any treatment by means of drugs or chemotherapy or radiotherapy or anything like that. I just thought, do you know, how many years have I got left here? This is a big deal that I've probably caused myself through spending too much time in the sun and spending far too much time in sunbeds. Daily use when I was younger. Don't use any of those activities now, and I haven't done for a good 5 to 10 years, but I do believe it has a huge impact, and I've probably caused all of that damage to my skin way back when I was 18 years old, so 19 years ago. The effect in my daily life, I think the only effect was coming to terms with the situation, the news I'd been faced with, the fact that I had a young daughter. What's my lifespan going to be now? Am I going to be here 5 years, 10 years, or am I going to grow into old age like everyone else, or like most other people? Now, that was the first couple of months I felt like that. Now I don't feel so blue about the whole situation. I know that it's very important to check my skin, notice any changes, see the GP, and I go for 3 monthly appointments, so I know it's very important to be aware of any changes in my skin in advance of these appointments, and I know I can also pick up the phone at any time if there's anything concerning me. I've also been to Las Vegas, I've been going to New York, I'm continuing with these family holidays, a fortnight in Mallorca every year. Life hasn't changed one bit for me, only that I need to be more aware of any changes and anything that I think is just not right in the surface or just under the surface of my skin at the present time. I'll be continued to be monitored for the next 5 years between the surgeon and the dermatologist. And I know at any point I can pick up the phone to the Macmillan nurse and also the dermatologist if in that matter, or go and see my local GP who are well aware of my situation. When I gave the news to my family that I went on my own for all of these appointments, thinking nothing wrong with me, I'm fine, I'm 37, I'm pretty healthy, go to the gym, lead a pretty healthy lifestyle. Do like my few wines with my friends at the weekends, however, who doesn't? Still didn't think that I was going to be diagnosed with skin cancer. Therefore, went to the appointment on my own. So I then had the news to break to my family, my friends, my husband. I think my mum was a bit scared. I think she was pretending she wasn't, because I was obviously scared. I didn't know what life held for me. I think my husband was particularly scared, having a wee one, just not knowing the situation that I had been faced with, not knowing had I given him the full information that the dermatologist had passed to me. However, he reacted very, very strongly. He was a rock, I suppose, pretended nothing had changed. That's fine, you need to keep out the sun, you need to be very careful. We will join you, because he probably spent far too much time in the sun as well, as did my daughter. However, I always make sure she's well covered, but she's still fair, and spends a lot of time in a lot of time in the sun, in these family holidays. My opinion, my husband was very, very strong about the whole situation. However, that to me, because I felt a bit emotional about the whole thing. I felt he was dismissing it as if I'd just been told, oh, you've got a scratch on your leg. However, it was his way of dealing with the fact that his wife had just been diagnosed with skin cancer. He was, I suppose, pushing his own feelings aside to protect me in the whole situation. Which was good for me, only when I was going through my little episodes of thinking, oh dear, what actually does this mean? What does this whole skin cancer mean to me? Then I would get a bit upset that he wasn't showing more of an interest in the fact that I'd been diagnosed. However, again, as he was just protecting my emotions, protecting my feelings, and trying to, everything's fine, Lynsey, everything's going to be okay, you've been told this, everyone's keeping an eye on you, you know what to look for now, you know to check, everything's going to be fine. So he was just protecting me. I feel the dermatologist I seen was very specialist in his field. He was, I would reckon he was in his 50s. I think, I know the skin cancer rates are increasing dramatically, especially with the people in my generation, 17 I believe to 34, 35. I do think the melanoma was in my skin when I had my baby, just after 34. Because I remember thinking at the time, watch that thing in my back when I was going through the whole pregnancy issues. However, never thought to ask anyone. But the dermatologist I've seen, I know now, in his eyes, he knew I had skin cancer, but wasn't willing to say until he got the pathology reports back. But I think he was well versed in what he was looking for. Therefore, I've got full confidence in him that when I see him every 3 months, and with myself, with me checking my body so often, noticing any changes, I'm confident that everything is going to be okay, and that he's going to, between the two of us and between the surgeon, any changes are going to be noted and spotted straight away and dealt with promptly, which is what we really need in this situation. You need to notice things promptly, because it is curable. Skin cancer's must be up there with the top curable cancers, but only when you notice these changes briefly and react to the changes instead of putting it off like I probably did. However, I was really lucky that it was slow growing, because the outcome could have been far severer, or a lot worse than what it is actually now. I think the skin as an organ now is very, very important. You can't live without your skin. Your skin protects your organs internally. Therefore, I think we should be more aware. I think we should treat it better. I think we should look after it better, I should say. I think there's too many people, and most of my friends, knowing that, well, there's 3 of us now. There's myself, my friend's mum, all in the west coast of Scotland, all been diagnosed with some type of skin cancer with different severities, and still my friends are out in that sun for 12 hours a day baking themselves, thinking, my skin, I want a nice healthy suntan, not realising what that healthy suntan actually means. I didn't know that a suntan was skin damage. I thought sunburn was a skin damage, but not a suntan. However, I now know that this is the colour we're supposed to be. There's so many other ways of turning your skin brown, I suppose, but one of them doesn't have to be baking yourself in the rays all day long. I think we should really step up a lot and look after our skin a lot better, because I think it's something that's highly ignored by the majority of us. I don't think we give it, if you had something wrong, perhaps with your back, or sore back, which comes internally, muscle pain or stomach pains, you naturally go and see about it. If you have any changes in your skin that you notice, whether it be a funny looking mole or eczema or psoriasis or any type of skin complaint, I think we seem to ignore it for far too long before we actually go and ask about it, before we get help, before we ask our GP for any diagnosis of some sort.